Hey folks, Dr. Moja here. And on a previous video, I shared with you that Ellen started chiropractic care because of her migraines, and that's why I became a chiropractor myself. But I never, dived into what it meant to me and how that experience totally changed my life. So when we were dating and we were at Hanover College, she would have these migraines, and they were more often than not. And she would get down and out, and she would have no hope, right? And so she went to a neurologist, and the neurologist did an MRI, saw nothing was wrong. So pretty much she said, Ellen, these migraines are in your head, but here's this anxiety medicine. And if you have a really bad migraine, here's a powerful shot. That, just so you guys know, the shot was so powerful that she would have to be sitting in bed, give herself the shot, and she would instantly pass out. So that was their solution to her, just kind of brushing her off. But because of the lack of hope and integrity and just care, Ellen would cry herself to sleep night after night because of the pain and the lack of hope to a solution that she was struggling with. And the chiropractor obviously guided us. He did his evaluation. He helped her and got rid of these migraines. And then, as a chiropractor, now I can maintain her and I can keep her going and keep her spine aligned. But what was neat about the chiropractic experience is the hope that happened just within just a couple weeks, how drastically our lives changed. And what I always tell, and his name is Dr. Morrow, and now he's retired, and love him dearly. And now he's retired, having fun with his grandkids, and he deserves that. But he literally gave me my wife back. He gave me Ellen back because now I can, take her on dates. We don't have to cancel going out to on a date, going somewhere. She is back to who she is. And that's what health does. It allows us to be fully present and productive, present at home and productive at work, and I want to deviate, and I don't want to make this conversation all about me, but of course, if you've known me for very long, you've seen me lose around 150 pounds. And so for me, my story is I'm getting my health back. I'm getting my vitality back. And of course, we're not a weight loss clinic, we're a chiropractic office, but I was able to regain that health, and that means something to me. And so that gives me a little bit more passion when I'm working with you guys and I'm working on your spine, and I want you guys to have that health back. Now, our vehicle as the office, as the chiropractic office, is to help you along with your spine, allowing your spine to function, allowing your nervous system to function better. That way you get that piece of your health back. Right? Because as I regain my health that I desperately needed, I feel like I'm a better father. I'm a better husband. I'm a better community member, a church member. And honestly, I think I may be just a better doctor as well, just because I've walked the walk with you guys. I'm right here with you guys. And so that's what I want to do with you is I want you to be more present and more productive. Now, to really have your health, yes, we want to correct the spine and work on it and be really diligent and aggressive about it. But then what happens after that? And that's where maintenance is so critically important. If I were to stop doing what I am doing right now, or what got me to lose my weight, what would happen? We know that answer, and I'm very fearful of that. So I'm very diligent, and I log my food and everything and my workouts, because I don't want to go back. I don't want to be almost 400 pounds again. I like how I feel, right? And so I want to maintain that. And so that's my encouragement for you is we want to maintain the health, the integrity of your spine. Now, what's really neat, and I'll geek out for a second if you give me permission, is in school, in chiropractic college, we were told, okay, somebody comes in with arthritis bone spur formation, which is calcium deposits along the front edges here, that we can't get rid of, right? Once you have them, once you have those calcium deposits, they don't go away. And so I believed that for the longest time until I started just experiencing something different. So when I start, having these maintenance re-X-rays, on the maintenance care, we re-X-ray every couple years, okay, just to make sure that we're doing what our part in making sure everything is going how they should, okay. And so I notice, and I'm looking at the X-ray with the person. I'm like, your that bone spur, because I have a digital X-ray, so I can have one up here and one up here, and so they were side by side, and I can go, that bone spur is reduced. How did that happen? And so over time, over the years, I've consistently seen this and seen this and seen this, and I've actually reached out to other chiropractors to make sure that I'm not crazy. And so the new research, the new and latest and greatest, is that bone spurs is absorbable in the body. If your body is realigned, it no longer needs to develop bone spurs, and it can then reabsorb. Now that takes time. It won't happen within 60 to 90 days. That takes years of continual diligent working on your spine, your spinal hygiene routine, drinking your water, doing your icing exercise, eating clean as best as you can, giving your body the building blocks that it needs to thrive. And so I thought that was really, really neat. And yes, I know I geeked out a little bit, but I hope this was helpful. I hope it was informative. As always, I love you guys, and I look forward to seeing you next time.